Good morning, folks. Good afternoon, whichever part of the US you're in. Um, I'm excited to have all of you folks join today's webinar. A bunch of you folks joined on time. Thank you for that. We'll of course see people trickle in through, through the next 45 minutes. I'm excited. Uh, Tons of health data security conversations, ton of automation conversations going to happen. I want to start with a story. I call it the green dashboard that lied. So a few months ago, we were doing an assessment for a mid-sized telehealth provider who very proudly showed us their compliance dashboard, right? And everything was green, obviously, right? So SOC 2 was check, HIPAA was check, access controls was check, training was check. Great. It seemed like a walk in the park. After that, we got to know 2 weeks later that they suffered a major breach. It wasn't a sophisticated attacker or some zero day. It was frankly a forgotten API of a vendor that was offboarded, which led to thousands of patient recordings being exposed, and all of this being done silently. What's ironic is that the compliance automation tool, of course, showed everything as green. It showed that the vendor had been reviewed. It showed that the policy existed. It showed that the offboarding procedures were done and documented. But no one actually validated if this was truly done or not, right? The dashboard just simply said green and secure, right? But the reality was otherwise. Now, this story isn't unique in healthcare, especially where lives and trust are on the line. Security is truly nuanced in the healthcare industry, and security compliance automation hence has to be very, very essentially implemented, right? Otherwise, it's going to give a very dangerous illusion of safety. Now, that's the conversation that we're having today. Why healthcare compliance automation demands more nuance. My name's Aditya. I'm the co-founder of Accorian. We're a New Jersey headquartered cybersecurity company. We specialize in security strategy, compliance, testing, audit. We're a high trust assessor. We're a PCI QSA, a PCI ASV, a SOC assessor, and we're also CREST accredited. We focus on health, finance, B2B SaaS, and enterprises, and we work with companies all around the US. I have over 15 years of experience in cybersecurity, and I've been both a pen tester and a GRC consultant. And I've worked in banking, financial services, health, and with governments around the world. With me, I have Richa. I'll let her introduce herself.
Thank you, Avi. Really nice to be here with everybody. I'm Richa. I'm the founder and CEO of Compliance. We are an enterprise GRC platform that supports our clients with a nuanced automation, things like controls management, audit prep, risk management, third party diligence, and trust. From our side, we really stand for the whys behind compliance. That's why our name is literally compliance with a Y. We believe in helping clients achieve the spirit of compliance and the real goals behind compliance, which is to reduce risk. And we believe in a partnership model, working with our clients, working with our services partners and theirs to bring them a complete suite of solutions that supports them in the way that their organizations need. And we believe that is the only real way to achieve nuanced compliance automation. Really glad to be here today. Glad to be with Accorian and talking about healthcare compliance automation.
I'm excited to have compliance on today. They've been a great partner to us. We've worked on a ton of engagements together, and hence the conversation today, because I really felt that the world needed to hear what is it that we've figured out amongst the two of us. On today's agenda, we're going to talk about the complexities in healthcare compliance. We're going to speak about where automation works and where it doesn't work today, and what does healthcare automation done right look like? We'll follow it up with a couple of FAQs. Right? Now, I'm going to jump into what's the representation today on the slide, on the call. There are over 100 of you who have joined. 70% of you folks are CISOs and chief compliance officers, and the other 20% being directors. There's 100% healthcare representation from the registration and the folks who have joined. So over 50% of you in healthcare services, which is phenomenal. And then 90% of you work in US health, which is the most regulated industry around the world, and hence the conversation we're having. So before I dive deep into, you know, what, you know, what are some of the things that we're going to showcase today, I want to talk about what are some of the most common complaints we hear from leaders like yourselves. The big one is in the next slide, which is our compliance tech doesn't work, right? As an auditor, as a VC, so as a compliance expert and advisor, I hear this all the time. I hear a lot of security leaders say it with frustration. They say, hey, Adi, I have the dashboards in place. I have my tools plugged in. The workflows are automated, right? Yet, the same people are chasing evidence over email. The controls are half implemented, and frankly speaking, they are unable to get an objective posture score, right? And needless to say, the audits will then obviously feel like a fire drill. The truth is, in most cases, it's not that the tech is not working. It's actually that the nuance of healthcare compliance hasn't been factored into by your automation tool. I mean, frankly speaking, if you look at the US health landscape, and an organization of your size, you can't treat a complex multi-security and privacy framework driven company that has so much of data, that has multiple sites, the same way that you would treat a SaaS startup with a handful of apps. It's a whole different ball game, right? So it's frankly not that the compliance tech is, failing you as much. It's just broken, right? And it's the same playbook that they are trying to apply onto you. And that is where automation has to meet nuance. Otherwise, it can't work. And that is where it has to be met with nuance, and context has to be brought into the picture. With that, we have a poll on the next slide, which is, so what do you do for your GRC tech today? And we'd love to know, are you on spreadsheets? Do you use a tech platform with a little automation? Or are you 100% automated tech platform that sometimes seems like a unicorn? All right, I see that tech platform with a little automation. And I see a lot of honest answers on spreadsheets being 30% of the GRC tech that folks are using. No, I appreciate everybody being candid. And this is the reality that we're seeing, right? With that said, these are some of the things that we're hearing from folks, right? And Richard, can chime in, right? I'm sure you're hearing the same things, which is it's not automated enough. The automations aren't customizable. What are some of the things that you're hearing?
Yeah, I think the one that breaks my heart the most is when people tell us, we never finished implementation, either because it wasn't really worth it, we weren't seeing the ROI that we needed, or because the implementation took so much of our team's time that it wasn't even the ROI. We couldn't spare the time. It wasn't worth the ROI to spare that time to put into the implementation. And so we kind of have this half-baked tool, we invested in it, so we're going to use it for a little while. And the reason it's just so frustrating is because these folks are losing faith in what software can do for them. I'm sure a lot of people on this call have had pretty tough experiences with software implementation at some point in your careers. I certainly have. And I think that when that happens, you start to feel like might as well just use Excel because at least I know how to use it. Everyone knows how to use it. It's really configurable. So even if it's only one dimensional, at the end of the day, there's less investment required for it. And therefore my ROI is pretty decent. And that's kind of the train of thought that we hear a lot. And that's hard to swallow, I think, because the folks who are dealing with it, they want more, but their tech is not necessarily giving them what they want. And I think we often tell them, like, look, your tech may work for other companies, and that's what they say. They say, our tech has other customers, seems to work for them. But the reality is that for healthcare compliance. Healthcare compliance, GRC, and security leaders do carry a heavier burden because healthcare compliance automation is demanding of more nuance. It can't be one size fits all because the reality is that healthcare compliance is simply much more complex. We're going to look at some stats against other industries, but first, Adi, I'll pass back to you to talk about some of what you're seeing with your clients.
Sure thing. So I think the first one is layered regulations. The average company, the US health company, has to comply with multiple standards, whether it's HIPAA, high trust, NIST, PCI, SOC 2, and that's more than a breath, ISOs, and a bunch of privacy and state level regulations. There are also regulations for AI today, right? The sheer number makes it so complex, right? And they all in some way amalgamate with each other, but they're also so different from each other, right? These regulations are unique in its own way. Imagine having to meet and comply over 10 or 15 different compliance standards. It's a lot of work, right? And you can't run it as a siloed program. And hence, this is the first big issue. The second is the data sensitivity. Unlike other industries, here you're securing PII, PHI, you know, credit card data, and much more, all in one environment, right? It's like you're trying to manage and secure everything under one umbrella, and it's hard, right? Because they all have their own use cases and workflows and how they're being processed in the various tools. The third is multi-site compliance, complexity, which is most hospital systems, healthcare organizations have grown because of acquisition, or they have a lot of legacy tech, or they have multiple facilities and sites, right? So they may or may not have the same inventory or tech in these facilities. That's what makes it a lot more complex, right? They also may have different rules, different rules, and because of the type of facility you have. Maybe one's a physician office, maybe one's a outpatient facility, maybe one's a hospital, right? Different sort of complexities come into picture, different types of tech. And of course, I have to talk about legacy systems again. There's so much of legacy systems that are still utilized in health today. And the fourth is the high stake vendor reliance. As you know, you're only as secure or as strong as your weakest link. And healthcare or health in general has a much higher bar for vendor diligence because of the sheer nature of the data that they have, right? And how important it is to secure, right? And the sensitive nature of this data needs to be managed well. And that is why the third parties and service providers that work with you have to be meeting the same security standard that you have internally. Uh, and that's the only way to secure all of this data. Right? In the next slide, I'm going to talk about, you know, and we're going to, of course, show how all industries and their inherent risk aren't really equal, right? If you look at tech, is it protecting data, right? It may be IP, maybe client data. In retail, it's protecting quality. It's protecting card information. In manufacturing, it's protecting quality, workplace safety. But in healthcare, life's at stake, data's at stake, everything's at stake, right? It's protecting quality, it's protecting data, it's protecting card information, protecting lives, and much more, right? And as you can see, this is why the inherent risk associated to health is so high, right? With that, I'm going to hand it off to Richa, who's going to talk to you about some of the statistics.
Thanks, Adi. I think whenever folks think of the most regulated industry, we often think about financial compliance. And that's in part because financial compliance gets so much investment. It has its own specific tech stack, unique to financial compliance companies. It has, it's all over the place. It gets so much attention, so many specific working groups, trade groups, events, everything. But when you look at the data, healthcare is actually a more regulated industry with higher consequences than financial compliance. And if you simply look at the cost of a breach, it is almost 50% higher. I was thinking about this and looking at historical data just to understand, okay, maybe with the increased level of cyber attacks, maybe this is a new stat. And only in the last few years have healthcare breaches become, the most expensive. But IBM has reported this is the 12th year in a row that healthcare breaches cost significantly more than the next highest industry, which is financial compliance. And if you think about that, The trend and the pattern that we have been seeing for years, over a decade, has pointed us to the fact that healthcare compliance is the one which is the highest stakes industry. And yet, what we see again and again is that healthcare gets the lowest GRC investment across all industries. And that just doesn't make a lot of sense, but it holds up. At Compliance, over 50% of our clients are in the healthcare space. We serve a lot of healthcare services companies, health tech, med devices, pharma. We serve Fortune 10 healthcare companies to mid sized healthcare companies. Every single one of them tells us that their GRC team is understaffed. They wish that they had more time, more resource, more headcount, especially as scrutiny increases, risks increase. But they are being asked not only to manage with the team that they have, but sometimes even reduce cost. Meanwhile, you have, SaaS companies who we also serve are raising money, raising big funding rounds, and then funneling a portion of that into increasing their GRC teams, which seems a little bit off center given the fact that their cost of breaches are lower, not as many kind of new regulations popping up for them. And you're kind of seeing that discrepancy. And then, of course, finance, which leads the charge, as we said, in the highest percentage across all industries of percentage of revenue that's reinvested into GRC protections. So it's just a bit of a lopsided conversation here. And I think it speaks to the additional burden that healthcare, GRC, and security leaders face, which is that you're having to deal with more nuance, more complex compliance needs, but with less spend. And that makes the whole problem even harder. So we think a little bit about spend and budget as you're heading into 2026. I know a lot of you are doing budget planning right now. And we did actually want to hear from you and understand, how is your 2026 budget changing? Is it increasing? Is it staying the same for GRC investments? Or are you actually getting pressure to reduce GRC spend in 2026? Love to let everyone take a second to vote here. I couldn't see the results the last time, Adi, so you might have to read them off for us.
Yes.
Curious what folks are saying and if it's going to be in line with what we've been hearing from the market.
Yeah, so majority of you folks are saying that the 2026 budget is staying the same. 13% of you said it's increasing, and 38% of you have pressure to reduce GRC spend. And
that's so tough. It's already a complex environment, and the pressure to reduce GRC spend even further can be such a tricky one. I will add in an anecdote here and share that, one of the reasons that I have folks sometimes coming to our door is to say, look, we are spending a boatload of money on a legacy tech platform. It may have been brought to us via politics from last decade, and now we're kind of stuck with it. It's super expensive, and it's really expensive to customize. Is there something that you can give to us that's a lower cost? I'd rather take that one off of my books and instead focus on something a little bit more nimble. And some of that actually contributes to them getting reduced spend year on year in their budgets. And I just think that's interesting to think about, different tech costs and kind of thinking about budget reduction that way rather than reducing headcount, which is such a difficult thing to do, especially in an environment with so much increased threat. Back to you, Adi.
Yeah. So what is in store for 2026? We foresee an increased threat. Why? Because as you know, healthcare data is a very, very lucrative target. And given how complex the nature of securing it is and how nuanced compliance is, it becomes harder and hence harder to protect and hence easier for attackers to look at it as a viable option for an attack, right? We're seeing the rise of a lot of organized crime. We're seeing a lot of script kiddies looking at health. We're looking at all sorts of increased threats across the board, and in a lot of cases, Healthcare is one thing interesting, and Richa and I were talking about it earlier. Last year, healthcare was the only industry in which inherent or your internal risk was more than external risk, right? We could possibly see that 2025 was a different story, but I foresee that coming back in 2026, wherein, it's going to be something to focus on. Along with that, what's changing is there's an increased scrutiny. All of us are seeing it on LinkedIn, right? OCR fining a bunch of companies. We're seeing fines, between a couple of $100,000 going up to a couple of $1 million. And they're across the board, right? Why they're happening, irrespective of, social media disclosure, pixels on your website. It could be, a risk analysis failure. It could be because you got breached. The OCR is really going after organizations and ensuring they're truly, you know, eating their dog food, for the lack of a better phrase, right? So, and whether they're staying secure. So, if you're stating that you're HIPAA compliant and you're not actually compliant, you run a very large risk of being fined, right? If suppose you're not secure, and that's what 2026 looks like. With that in mind, over to you, Richa, to talk about what do we do?
Yeah. It's crazy to think that 38% of you are saying that you are feeling pressure to reduce your budgets. And meanwhile, the environment is getting more and more and more complex. But I suppose that's what security and GRC leaders are used to hearing, especially in the healthcare space. So let's talk a little bit about where automation works and where it doesn't. And I really want to lead a more nuanced conversation about this because, as we've said, that's what healthcare demands. So, first, let's talk about high level, what we all know, where automation doesn't work and we know it. Automation, of course, doesn't work in setting a security culture that needs to be led by you. It doesn't work in setting risk tolerance that needs to be aligned with the board. It doesn't work in managing auditors, which often need a personal touch or support and conversation. Where does it work? Again, this level of discussion is not a surprise. All of the GRC tech automation platforms talk about cross mapping, evidence collection, continuous monitoring, evidence review, vendor questionnaire automation, and so on and so on. But as we've just discussed, that level of conversation is simply not enough when it comes to healthcare compliance automation. We have to go one level deeper. When we talk about cross mapping, as an example, everyone thinks about cross mapping as a low hanging fruit with getting a useful tech. You move from Excel sheets or more legacy technology into something more modern. You think about cross mapping as an immediate efficiency that you can get. And that's great. But I want to talk about the difference and the nuance between cross mapping with controls only and cross mapping with controls and or evidence. Because herein lies the specifics spirit of healthcare compliance that we need to address. When you are cross mapping with controls only, if you look at the left side here, you're going to do something like this. You're going to have a breach response plan control, which is applicable to SOC 2 and HIPAA. But in reality, you don't need a breach response plan to meet SOC 2 requirements. You need an incident response plan. But because you are trying to meet the HIPAA requirement and the SOC 2 control all in one, what you might do is say, okay, let's combine them and make this more efficient. The issue with that is that as a security leader, as a GRC leader, walking into audits, you want to make sure that you are meeting the specifics of the standard that you are going into an audit for. And you want to know in general, what is my percentage compliance? What is my compliance health with a specific standard? Because you need it. You need to report on it. You need to assess self-assess compliance or work with an auditor to finalize compliance with it. So we actually want to move to a evidence-based cross-mapping approach, which again respects the nuance of what is required. Maybe an incident response plan is tagged to SOC 2 and HIPAA, but a breach notification procedure is tagged to HIPAA only. And now you start to feel the granularity of how are you going to respond to a breach? Are you meeting the compliance requirements for HIPAA versus SOC 2? Just one small example, but it gets us thinking about the specifics that you should be looking for when it comes to compliance automation for healthcare. This is one that I hope everyone would agree with. Where automation doesn't work, off-the-shelf controls. As much as we would like to think that off-the-shelf controls solves all of our problems, The right answer is a blend of configurable controls and the ability to add custom controls. Some of our clients use SCF, or Standard Controls Framework, Security Controls Framework, as a way to cross-map controls and use those off the shelf. That's great. But all of them want to be able to tailor those quite generic off-the-shelf level controls to their own organization. Whether it's to give advice to their control owners on what it really means to meet the standards, whether it's to include what is out of scope, whether it's to define the parameters of the specific control. On the right side is how you start to get an actual grasp of what your compliance health is for your organization. So we keep going here. One of the common complaints that we hear is we have a compliance tech tool which has integrations, but we can't use them. A lot of the tools that are integration only essentially result in a more clunky and limited experience. And then what ends up happening? Clients just default to manual review. Those integrations sit there collecting dust or are never actually connected because IT teams don't have capacity. And manual review begins, which means the frequency of control monitoring is compromised as we start to think about how the control can actually be monitored. Versus a model in which you're using integrations and AI, custom integration tests, and AI reviewing evidence for a qualitative assessment. If you think about our perspective, Accorian and Complyance have a HIPAA AI agent that actually reviews evidence for compliance with HIPAA and automatically flags gaps. So it's reviewing evidence, whether that evidence has been uploaded manually or by integration. It's reviewing it qualitatively for the specific criteria that need to be met for a certain HIPAA control. And then it's flagging potential findings so that someone on your team, control owner or GRC owner, can at scale review the compliance gaps and essentially a automated assessment of your HIPAA evidence and flag noncompliance. In general, we're talking about vendor diligence. There's been a huge conversation around trust portals. And, it's great to rely on trust portals for vendor review. But the reality is that those trust portals do not offer the level of specificity that healthcare organizations need to monitor for their third parties. They may offer a SOC 2 report, or they may offer certain control sets or policies, but oftentimes you're seeing healthcare organizations need a much, much deeper understanding of what it is that matters to them. Are you requiring BAAs? Are you thinking about, your third parties? Explain in depth what your sub-processors have in terms of healthcare certifications. Those are not things you're going to find on a trust portal, but rather do in a much more tailored environment. In general, I think the rule for automation when it comes to healthcare is about humans having their hands on the wheel. It's like a Tesla. You can put it on autopilot, but at the end of the day, you need to make sure that you can grab the control back if you need to, if things start to go awry. And that's how we think about automation all the time. We'd love to understand from everybody at this moment, how much do you prioritize healthcare compliance automation right now? Are you on this call because it's not a priority right now, but you would like to learn more? Are you here because it's a priority for next year? Or is it a priority ASAP and you've been looking for the way to make it work internally? Love to understand a little bit.
I'm seeing some great results coming in.
Curious to hear this, actually.
And,
We hear a bit of a mix on our side.
That'll be a great segue into your next part. Yeah. All right, we'll give you folks a couple more seconds. Awesome. So 50% of you have said automation is a priority ASAP. That's huge. 36% of you have said that automation is a priority for 2026. So my big takeaway is 86% of you say that automation is required and it is a priority, right? Whether now or 2026.
And only 14% of you feel like it's not is very telling. There's been a lot of talk about, bringing AI and automation into healthcare and how to do it in a way that actually works. we have seen some clients and some companies in the space do this really well. And we wanted to share with you a little before and after of how they've actually managed to bring automation into their environments in a hopefully easy to understand way. So we're seeing companies right now have a pretty, I would say, expected kind of before picture. They're managing controls in Excel sheets across their various standards. They're reaching out to control owners for evidence when they can. Sometimes that's every quarter if they're lucky and if they're able to with the resources that they have, but oftentimes it's every year or just before an audit because that's all the capacity that human beings have to be able to manage compliance in a constrained environment. Then they're sorting through the evidence because, as we all know, control owners kind of give your team evidence in whatever way they so please. That might be in Excel sheets, that might be in email links, and you open the OneDrive and you don't actually have access to it, and so on and so on. So it takes a long time to even organize that evidence. Then you have to review it, log those compliance gaps, and then address them. That's a before picture that a lot of companies resonate with, especially healthcare companies who feel forced into manual process because it's so nuanced that they don't feel like any automation can possibly help them. In the after picture, you see a little bit of a different story. Those controls and the evidence is cross-mapped. The evidence is either pulled in using integrations, or the platform follows up with those control and evidence owners on a frequent cadence and chases them. When those folks add evidence, it's automatically, of course, cross-mapped to controls. Then the AI kicks in, like our HIPAA AI agent that reviews the evidence and automatically flags those gaps with actionable findings on the controls. And then human takes the wheel and addresses the compliance gaps just as before. But now the capacity to address gaps and have the headspace to think about compliance gaps as a priority instead of as something you have to address before an audit has increased by hundreds of hours across the course of the year. And that's some of the impact that we're able to see. This specific story is from a health system, I should say, that operates in the Eastern United States. And they actually they actually had a tech that they used before. But because it didn't work for them, they were using Excel anyway. It's too often the story that we hear. Using Excel and SharePoint, kind of using your old tech as a repository tool. And what they were able to see is that they could actually handle more compliance standards with the same number of resources so that they were able to do additional checks. They brought on NIST CSF maturity assessments as a way to report to their board because they had the capacity to handle that in addition to HIPAA, high trust, and everything else, PCI, that they were already doing. I'm going to go through one more example before we open it up for questions. We talked a little bit about vendor diligence, and Adi talked a little bit about how the importance of vendor and third-party risk management when it comes to healthcare data. Again, this is a client, a very large healthcare company. They do med devices, pharma, and customer-facing health. Before, they were sending out Excel and Word assessments via email, a very common practice. Someone was chasing those vendors for a response. They were manually reviewing that response. Oftentimes, the vendor had unstructured answers or they needed to follow up on certain risk areas before they could even consider making a risk assessment decision. And then, of course, afterwards, they were monitoring every year. In a more automated world, they were able to focus their time on that purple box of the decision and thinking through the strategic consequences of having that vendor sub-processor on board, because the rest of the process was heavily automated. All of that work that wasn't necessarily high value, like sending out the assessment, chasing for the response, making sure that it fit the format and even answered the original question completely, and then sitting down to decide, okay, what is the risk profile of this vendor for our business? And that's where you want to be spending the time. That's where you pair, again, automation and AI with hands on the wheel human expertise and judgment. And that's how we get to a much more nuanced approach to healthcare compliance automation. I wanted to open it up to questions, or Avi, if you have anything else you want to add in first.
No, I think that was great. I mean, you've broken down how compliance automation should look like for the health industry. With that, I'm excited to get some questions and
Love to open up to the floor here. If anyone has any questions or thoughts as you've been hearing these stories or thinking about your own 2026 plans. I know some of the FAQs that we often get from clients is, as healthcare compliance automation is more nuanced, it means you have to trust the technology more. And how do you trust the technology? How do you make sure that the tech is actually meeting the bar that is set, internally? That's a really hard one. I think it comes down to a number of different factors around the tightness of the actual features that are being developed, the way that the data is being trained, and how much control you have over it. I think one of the issues is the black box effect of AI, just running amok and doing as it pleases. I think it's really important to always have rationale built in, configurable parameters that can be set by the client, and so on. Any other
yeah,
questions that you see from your side?
I often see a lot of tools trying to, it's like a round peg in a square hole situation. They're trying to take your GRC program and and somehow figure out a way that how you could work on that tool rather than looking at the tool and tailoring it, with your GRC program, right? Which is so important. All right.
People, process, then tech, right? I think that's
Yes.
how it goes. People, process, then tech. You don't want to do people, process, tech, back to process that works with your tech. That's not how best practice should be.
So there's a question that's coming, which is how do I ensure I can use AI safely and keep track of all of it, right?
Yeah.
Very pertinent. I can take a first pass at it, which is you don't know what you don't know, right? First, start by understanding and doing an inventory of all the AI solutions and tools that you have internally, right? Understanding whether you should be utilizing them, using them or not. And there are multiple ways to do it. You could do an inventory, reach out to all the teams, you could look at your logs, you could look at your credit card bills in a lot of cases, right? And figure out, hey, why are you paying for these tools? Check for your DLP logs. Once you have a sense of that, right, that is when you know which ones to, you know, have on your allow list and which ones to have on your block list, right? I think that's the basic that needs to be done. Next is having effective DLP solutions tested, verify, trust but verify, as they always say, right? Just because the DLP says it works, it's important for you to test it, right? So do that. And I think there's a couple of ways of how you could start using, AI safely. And of course, try and understand what data is being shared. Are these models or these tools learning from your data and the likes of them? So follow the breadcrumbs of how the data flows, right? Rija, any thoughts?
I'll answer maybe a different part of the question, which is how do I ensure I can use AI safely? I think it's really important to look at the AI privacy terms of all of your AI vendors. And specifically, I would even look at their subprocessor list. So I know that when AI started to, take hold, especially generative AI, you saw on people's subprocessors list, which should be public, you saw folks having ChatGPT on there. That's an instant red flag, obviously. Now we've matured a little bit beyond that, and folks often have, slightly more secure providers giving the AI in their environments. But it's important to make sure, for example, that the companies are using enterprise grade, privacy first deployments of AI in your environments. The second thing is to make sure that these folks are not using your data to train others. Now, that often comes in some sort of settings page where you can toggle it on or off, or it's just firmly in the contract that this data, your client data, will not be used to be training the LLM or any other client environments. And lastly, you can kind of get a sense by if your vendors are allowing you to opt out of using AI completely. That's another great sign. If they are auto enrolling you in new AI features that they release, it likely means that they're not thinking about your privacy as a client at the top of their priority list. And so if you're thinking about environment, you should always be able to turn AI off completely in the environment and still get great value out of the solution and essentially work in a way where you're partnering with your vendor to make sure that it's the right answer for you. Something that we hear a lot.
So
Any other?
I have a question that's come in, which is directly, which is how do you essentially integrate compliance automation platforms with existing systems or legacy infrastructure, or what's the best strategy to have there?
Yeah, it's a great question. So I think first things first, oftentimes folks say off the bat, it's not going to work for us, either because our tech is legacy or because our IT team is overstretched. So it's a nice idea, but it's very pie in the sky. And what I would say is that, first of all, that's okay too. If you feel like you're not going to be able to integrate anything, there should be a lot of value that you can get out of a solution even without that. However, I would challenge you to say, is there some areas that we can integrate? As simple of an integration as SharePoint can go such a long way. Jira, ServiceNow, Freshservice, because it allows your control owners to work in the systems that they are used to and simply bring in that information right into your GRC tool. And a lot of GRC tools have off-the-shelf integrations, very modular integrations with tech like SharePoint, Jira, Asana, OneDrive, because those are actually quite simple integrations to build. And now all of a sudden, you've unlocked the ability to bring in that source of truth information automatically in the environments that your control owners are used to. I don't know. Sometimes I think that we make a big hullabaloo about integrations, but it's actually quite straightforward.
Yeah. No, for sure. I think it boils down to integrating with whatever's possible and making sense out of that before worrying about everything else. There's one last question, which is very interesting, and there's a lots of questions that have come in, but there's one very interesting question that's come in, which is, um, how do I build a business case and how do I quantify ROI?
So I'm curious, Ali, how you answer this. But for our side, we're hearing a lot about this right now. Folks are building their 2026 budgets, and they're coming out to us to basically say, hey, just can you give me a quick price and a quick understanding of how to build this business case? And I kind of think that it's always going back to the problem. I think that's the most important thing. Are you currently feeling overstretched? Are your resources not enough to do XYZ that you want to? What is it exactly that you're not able to achieve? What is the value of being able to achieve that? We hear all the time we don't have the capacity to think strategically about this. We don't have the capacity to do real risk assessments or to follow up on the risk treatment plans that our teams have committed to. What's the value to the business if you had time to do that? And if we're able to make that value real, oftentimes it's significant compared to the potential cost of a tool. You think about things like the cost of a data breach that we just discussed. Even if you're able to reduce the chance of that happening by 3, 4, 5% by using automation, you are more than paying for any automation tool. So I think those are some of my top of mind answers. Curious,
Uh,
Ali, how you see.
no, absolutely. I think just the human hours that one would, save in everything
Yeah.
that they do, right? I think if one would sit down and quantify that across audits, across risk management, vulnerability management, just managing these multiple compliances, the human hours are thousands, right? And that's a direct dollar benefit so that you can focus on real security, which is, and look beyond compliance. There's one last question, and I know we're to time, but which is auditors and assessors push back on automation when for audit evidence. What can a tool do to support to ensure that auditors accept these outputs?
I'll give you that one, Adi. How do you trust, what do you guys do? How do you
Yeah.
think about that trade-off?
So the way we look at it is we look at timestamps. We look at how frequently has the data been pulled. We look at what is the trend across that particular control and its evidence to understand and assess implementation, management, and monitoring, frankly, right? And all of these gives a sense of whether this evidence is good enough or not, right? Um, and at the end of the day, auditors want to verify if things are in place, and they're not going to look at all the samples, right? They're going to look at a few. And I think compliance automation tools have definitely made auditors' jobs much easier because they very, very beautifully lay out evidence across an entire timeline. So I can just click through, I can see for that particular timeline what evidence is available, whether it's been compliant or not, right? And yeah.
I kind of laugh because I think about, when I have been doing audits in past roles, and let's just say in JIRA, for example, I'll pull a JIRA report, and then the auditor will always say, "Great, show me the filters or the JQL query that was used to create this report. Show me a screenshot of that." So, like, okay, well, I can manipulate it as well, by the way. But anyway, so I can obviously, do that. Then you take the screenshot that shows the JQL query or the filters and then shows all of the evidence below it. Or you can just have the tool generate that and then you can prove it still by doing the same thing. But now you're not taking the screenshots. You might just be in an audit interview and your auditor will ask, let's validate the data that we're seeing in the platform. Please open your JIRA environment and run the JQL search. It's still a huge reduction in work and all that prep that you're doing to pull it up, even if your auditor wants to validate it during a field, a field work portion of the audit. I think we have one final question here before we close out, which is that what governance is in place to track changes to the AI model over time so that the same evidence yields the same evaluation results? It's a great question. I'll answer this very quickly because it's quite a technical answer. But in short, it's about the tightness of the feature itself. What I mean by that is the reason that AI and generative AI hallucinates is because it's very open-ended, right? So when you're asking a question about, where should I go in Italy? Obviously, it's going to give you a different answer every time because it's the scope is huge. But if you've built AI features the right way, you can target the scope and the context that's given to the AI to be so tight that you actually can get extremely deterministic outputs within a very reasonable range of clarity, of accuracy, of satisfactory results. And that's actually what we've seen. So the tighter the feature, the more specific the context, the more driven the output, the more deterministic and reliable the model is year on year, time on time. That's the quick answer to that big question.
Yeah, context is king.
Context.
Awesome. Great. So this was a great chat. I know we're well over time, and a bunch of you, actually, everyone's almost stayed back for this entire Q&A session. So thank you all. You can reach out to us on LinkedIn. Richa and I are very easy to find, both the Accorian and Compliance team. That said, thank you, and until next time.
Thanks so much, everybody.